Your first pregnancy and your second pregnancy is different because your body went through the whole pregnancy already. So it's more prepared to jump right into each each stage of what's to come. Um, so I would say that because I've already experienced pregnancy and um, I knew what to expect. I was anticipating different things. First trimester, your body is working very hard. I was feeling all the effects of that. Just wanting to just relax. I would say I wanted to eat, but there was things that I didn't want to eat, things that I didn't want to smell. That's one of my main symptoms. Was if it smelled bad, like I just couldn't tolerate it, and it really bothered me. I couldn't smell seafood, like I didn't want it. I was just like, ew, like so disgusted. I just didn't want it. And that's kind of when I knew, like, okay, things are happening. I started to feel I started to feel bloated, but more in like there's a reason for my bloat, as opposed to like, oh, I'm just sticking out, like my belly is just sticking out, or I'm just feeling, my stomach is just feeling heavy because I ate all this crap, whatever. It wasn't like that. It was more so I'm feeling bloated because my belly is like growing for some reason. I was nauseous. I was kind of just wanting to lay down and relax a lot. And I think that's because like the baby is like taking a lot of you in the beginning. I think that's why first trimester is one of the most difficult trimesters for a lot of women that I've researched. Going into the second trimester, you kind of feel like those quick movements inside your belly, but you don't feel it on the outside. You just kind of feel different things. Like it could be gas bubbles, it could be the baby doing a flip, anything. Because at that point in your first trimester, your baby is still pretty small, and your uterus is still pretty small. So everything is not as defined as it would be, for instance, like the second trimester or the third trimester. I felt baby move a lot earlier than I did with the first pregnancy. There could be so many different reasons why you feel or don't feel your baby move early. Like if the placenta is in front, that kind of cushions between the baby and you, so when the baby kicks, it's kicking like the placenta, so it's more soft earlier on. Because the baby's not so strong, you don't feel that movement too much. It could be that. It could be maybe there's more space for the baby to move around. Like your uterus kind of have to be closer. As it keeps getting bigger and bigger, it stretches to the lining of your belly. The closer it is to you, the quicker you feel your baby move. In the second trimester, internally, you start to feel movements. Like you feel jabs, punches, kicks. You feel little rolls and different things, but it's still not as defined. Like you don't feel it on the outside. I have been having cravings. I've learned that cravings are more so like what your body is needing. For instance, when I'm craving like dairy products or things like that, like milk or cheese or whatever that all consists of, and maybe my body is telling me that I need more calcium or different things. So if you have the time, you should understand your diet, the things you eat, and what your body is telling you when you are wanting more and more of this specific food. Some doctors encourage you to count your baby movements, and it may be specific to you. So, just the very first and most important thing is to really be in tune with your body throughout, from start to finish, and just in life in general. Just know what's going on with you, especially when you're carrying your baby. Know what's going on with yourself. And if you have anything, any questions or concerns, reach out to people who've had children, or your doctors, or just search for as much information as you can, because you want to know, and you should know, and there are people that want to make sure that you know and you feel as comfortable and as confident as possible. So reach out to people. You'd be surprised at who all wants to just be a positive influence in your life. Do research, but try to hear from people. Like, try to read people's personal experiences, or look for people's personal experiences, just so they can kind of describe in their own words what they experienced. Because a lot of the articles are just the same thing. Like, you find the same information, and it doesn't really answer, it doesn't give you a lot of details. Be self-righteous enough to be able to trust yourself and your own judgment, because you know first and foremost what you feel. And a lot of people that you're expressing your feelings to, they don't always know what you are describing, and so their advice could be not so helpful sometimes, or um, just complete opposite of what you need to know or do. So really do the work for yourself. That's like a big thing you should change in your life. If you don't do that right now, really work on yourself. Work on being in tune with yourself, knowing your body, and caring. Just self-care, like caring about yourself.